injection and the buttocks, the filler, the microneedling, and also they want a more approach of holistic care because everybody wants the more safety and they will save money, so they want to try the home, the beauty care. So today I want to mention about that in holistic care and self-care in home, and also we have the more medication because we have a lot of the diet care and then skin care, the product, for example, the biotin, the zinc, selenium, and also they have collagen. So we have more approach that more nutrition and mineral and or nutrition, the food, and then nutrition and natural health care, then also the cost care. So it's more combined, it's more the synergy. Okay, so I want to try to this magazine and nutrition health. We have the more the shape salt, so salt and sugar. So how can you using the more approach more skin care, the cleansing. Also we have the moisturizer and we remove toxin the skin. Okay, so I will copy for you. Okay, the page the 15, the textbook, the top aesthetic medicine, the trend for 2025, the insight from the diet and the mission, the PhD of our origin. So we have more research teams, 5 people, they have announced the evidence of scientific and the natural product and then holistic care, the skin care field. So key point, the non-surgical the treatments for the low face, leg, and then the jaw line, and encouraging the puffers. So everybody want more shape, the shape, right? So and then they have more, they're more cracked. So they're more tight and lifting because everybody wants the more bone wound and the more the ball. Just like the egg shape is very good for the beauty, the symbol. But here the jaw, because everybody wants the more surgeries, the jaw line here and also wrinkle too. So the jaw line is incredibly popular. So why? They have the shape, right? It's more looks like the more try to approach the more the makeup is more the eyebrows is more the right? It's more very ticklish and also they have a more looks like the shape. So usually this makeup the skill you can more up the lifting too. Now because the BB cream and then Botox too and the filler. The last time I explained to you the filler is more the muscle here, then the volume here, and also Botox more they paralyze the muscles is not the movement, right? So they have the remove the anchor. So but we have more approach the skin care, the naturally they have Botox the BB cream. Also they have English is more protection the natural protection too. So I suggest to you we make more Botox the naturally. It's a more usually I have some home care products and sometimes I mix the egg yolk. The egg yolk is maybe egg yolk and then kiwi and the green tea and the aloe. I make the pack sometimes, so I'm using my paste is more lifting the effect. So egg yolk is very good, popular, and then save money and then safety. Okay, so I want to give you one products, the GLP-1. The GLP-1, the medication, the insulin, insulin, right? Insulin, so obesity, they have insulin medication, the injection. It's my patient have every week, one time is a Ozempic here. So they control the insulin and then glucose, right? So the GLP-1 medication they using for the injection or the supplement, they help the more metabolism and also the inner beauty. So they controlling electric water and the insulin, the blood sugar. So the blood sugar, they're very important because the blood sugar sometimes they have the the impactful work for your skin tone. So you can see it when you see your neighbor or your family's patient, they have so many wrinkles and dry, you know. So GLP-1 ingredients they include the costume wear and the supplement is very useful your overall health. Okay, the GLP-1 medication influence aesthetic choice as weight loss often leads change in the skin elasticity and the taste volume. The encouraging interest elastic treatment. So GLP-1 have the patchy and the mask they come in. Yeah, because hyperology, right? There's so many cosmetic industry they want to research. They try to more the weight loss because very weight loss very important. So too much apply the weight loss, the skin is dry, and then they have the too many anchor, and then they have the more down, so your low volume. Yeah, so evidence back the skincare and then personalized the minute insect the production and the high demand. The reflecting the consumer desires for effective the science-based solution. So sometimes we have the two products, the skincare. One is brand too much the loyalty brand here and the normal brand here. But we have to check price? No. We have to check the nutrition pad, the backside bottle. They have ingredient and then high technology and then dust and what kind of the side is the ingredient here, the chemical or this natural, the eco. So you can see. So it didn't matter the price, it didn't matter the brand. So you can check the nutrition pad, the ingredient, okay? Then apply what kind of type. We have the oily skin or dry skin, the combined skin. So you have to try to apply the skin type first, okay? Yeah, today I have an episode. So every Saturday I come here. So I'm gonna record the YouTube, right? So I'll do more the pace out, it's more writing bright. So I'm gonna try the foundation in the base of the skincare and the skin emulsion. But today I tried the sun cream. The sun cream, the white colors, they have the skin color, they have the biotin and sun cream and the BB cream. So I tried today is more light, it's my peer. So I'm gonna try this product. So you can try every time, and seasonally you can change the cosmetic product with your season changeable. Okay. So this summertime, too much the cosmetic medicine is sometimes we have the skin they don't have the breathing. So we have the skin tone, it's more fresh air. So we have the tiny and then tight to the skin case much better. Okay. The page 15, the technology and then regenerative the medicine, but the other advantage aesthetic medicine. So enabling the place, the natural looking results and those AI, the imaging and then regenerative, the technical. So I have the AI, the cosmetic, the analyze the test. So many people come in. Is we check the skin tone and then maybe some people have the surgery, the fresh surgery, so Botox filler, and they have a silicone inside, so we can see it. So sometimes we have to taste the smile, and we have to change the muscle, myofascial, and then little filler or Botox stay the little movement position, so we can see it. And then you have to apply the aesthetic massage or we have a lower massage and the skin care. Okay, so very useful and then more the safety than last time. Okay, because we don't have the AI analyze test machine. Maybe we don't know that, right? So many people that complain and then they had the side effect. So now so very good to the high project. Okay. The 16. The clinicals should focus on patient education and trust, integrating asthmatic the treatment it varies to enormous quality of life and shift focus from the lifespan to health span. This means now everybody wants beautiful, but it's not the skin. Also, we have inner beauty. So solution. So everybody wants the echo and then naturally in the lifespan, right? So not too much approach the cosmetic, the chemical side, and then also the medical, asthmatic, the treatment. So at least we have to keep it's a naturally echo lifespan is some very important. And especially if you want more the medical asthmatic treatment, you have to talk to the advisor, the professional or specialist. Okay, so we have the minimum, and then also we have to more approach the echo, and it's a naturally maintenance or skincare is much better. Okay. As the 2025 approach the period of aesthetic medicine, the continued evolve is a new innovation and the consumer the demand. What's demand? The customer want more eco, more save money and the safety and more no damaging, and also we have the more combine and the synergy the values, okay, and the new innovation, right? The shaping the landscape. So everyone naturally, okay, because you are young people, right? So you don't need not too much the skin care. Yeah, but it's under 54, so I need a little skin care, so I had the more maintenance. Okay, so you had the more, you guys, you had your ages, you had the more try to the more nutritionally the balance and the hydration, because now we have the especially summertime, so we need more dehydration, so we need more vitamin, or also if you're summertime, you can make the aloe, it's good for you, okay, the green tea. The Diane's mission as a PhD, the senior vice president of aesthetic R&D, the Lordland Estimate, to share his insight, the top trend that is defined this year, or 2025. Everybody want more cut down the chemical, the ingredient. So this means the before the chemical ingredients you can store it a long time, maybe for example 2 years, over the 2 years. Yeah, every the product, the nutrition or supplement or the cosmetic, usually they have 2 years. So they want to more keep the storage, and because they have more save money, also they have easy storage handling. But now, little short, the expire maybe very short, because the hydrology they got the chemical ingredients, the organic, eco. So eco means naturally, right? So little bit to cut down the chemical, so storage time little short. So if you want the shopping, your the skincare shop or some the retail store, you can see. So some products have the more expire very short, and handling the maintenance or the storage, the deep freezer, because the room temperature didn't very change, right? The benefit. So and this one is a room temperature so the 3 years. So this product is more chemical ingredient. Okay, so you have to do smart shopping. Once found the lies on the surgical the treatment, the targeting is low pace, like the jawline, right? So grading influence of a GLP-1 the medication on expected choice. So the mission I explore the factors driving the industry future. So before 2025, here have more chemical ingredient. Okay. Now they showed here study style day and the first echo. Now they have more short ingredient. The first, the medication. Yeah, the GLP. Well, actually this one, the Ozempic, the insulin. So they this evidence, the GLP-1 and the people we have here the supplement usually the collagen, the biotin, the B6. So they have the 2025 for they have usually here and the chemical, but 2005 and the short expire and then more echo, and 2006 they have a high quality and then they approach it's more those short expire and also the treatment, the medical treatment and the medication. Okay, so little change. The real focus evidence back in skin care and advancement is then regenerative the medication, and he also highlight how technology and personalized care and having the way of the new ways more the approaches the natural looking the result. So this is very important. They have a more approach the natural. Yeah, natural. Okay, naturally. Yeah, so naturally is very good result. The question answer. Okay, I will question. What is some of the most scientific trend in our innovation in aesthetic medicine in 2024? I already give the answer. What kind of the treatment? Yeah, 2025, the cosmetics, the ingredients, and also just supplement, right? Yeah, but 2025, they have medication. Okay, so echo, they want to try echo, and also they want the more inner beauty. Okay, the beauty, and also insulin and the hormone balance. This one. Okay. The page is 17. Answer. Okay. 2024 was a pivotal year for aesthetic medicine. One of the most notable trends were the growing focus and is shaping in the low-paced leg and the jawline using minimally in the invasive treatment. Okay, this is the treatment, but the supplement. Also, they have before. Yeah, here, jawline. Yeah, jawline. So they want cut, right? So more shape this one, and lifting, right? Lifting here, and also here they have the more buttocks or the pillar. For 2025, they have the jawline. They not minimize, and the lifting. Okay, and also here the lifting. So the before they have the buttocks and the pillar and the microing, and then usually the shape this one, but now this one lifting. Okay, so minimize the jawline. The individuals, the soft, natural looking results without downtime and advanced the non-surgical option to provide and rangeable option. So I checked the Amazon and then some website, the lifting they have, because usually the 2024, they have more lifting and shape here. For 2025, we have more the product, the lifting tape, because we have a scale too, right? We have a scale or a little line, so we don't need a surgery. We have no surgical treatment. We have a little patch here, maybe the wrinkle is removable, and then little patch here, more lifting, and then mask too. So mask they have more the Botox ingredient, the filler ingredient, the medication. They more the tight the capture is more make the shape, and also the cosmetic products too. So 2025 they want more to cut down the surgical treatment. The caption, what we see at the top the trend is shaping aesthetic medication, and in 2025 we anticipate the three core the trends are rise to top the 2025. The first, the growing demand for non-surgical low-pace the jawline treatment drive innovation in the pathology. Second, we are applying the impact of GLP-1 medication on appearance-focused behavior. As you know, many people who are engaged in medical weight loss are more interested in their aesthetic afterward. Because of GLP-1 is a Ozempic, Wegovy, ingredient, insulin actor, right? So they have a what kind of function? The GLP-1 perm, the posterior we had the weight loss. Because we have glucose and then we have more the control system here, so we have more the feed time rather than dinner, right? So we have the meal time, we have more try to cover the blood sugar, right? So this medication, GLP-1 medication, they control the cut down. So maybe we want here that we have the appetite here. So the GLP-1, the function. So this deadline here. So we want the outside into nutrition. They more top, they cut down here. So they more some the swelling and the diarrhea. So they don't, it's a line. There's no more. The market is no more. The overall. So the GLP-1, the function. Also they have a work for the weight loss. Yeah, so very important, right? So weight loss, the first one, and then insulin. Because we have the more the nutrition here, we need the insulin the level. So no over the insulin, some more control, and the cell nutrition, and then also the skin the nutrition too. Okay, page 17. The second, we are following the impact of a GLP-1 medication on the friends to focus behavior, right? So as we know, many people engage in medical weight loss, the more interested in their aesthetic afterward. So I have more the slim patch. So GLP-1, the products, we have the capsule, the powder, the injection too, and the liquid. And also you have pet. So the skincare industry before only production the skincare product, but now they plus and the medication, the function of the medication. So they have insulin and the collagen, and also biotin and the also the vitamin mineral balance. They work together. It's more easy make in the nano system and also nano technology they apply to the skin health. Okay. Page 18. In addition, the focus focus on the scientific problem, the skincare products inspired. Instead, they're addressing the gap between the available option and the clears that drive a cosmetic solution. Okay. The question: how have consumer demand shifted in the recent years, and how is the more industry adapting to meet the change? The page 18. The consumer answer: consumer today is more informed, and then declaring them is more before. They are looking for treatments that deliver natural leaders, and elegance is more their NQ aesthetic goal, and fits seamlessly into their lifestyle. Also, this the demand leaded to a development or minority in save the procession and social recovery teams. Now, this slide of holistic beauty and health reshaping the how providers approach aesthetic care. The industry also is leveraging the technology to create more purses, the customized solution reflecting or shift toward the personalization in the aesthetic. Okay, so how about you? Your cosmetic care every day. You have a skin lotion, your face. Your cosmetic every day. You check you wash your face, and the skin lotion, the foundation, nothing, or something. Yeah, so everybody protects the skin care. So I'm every day washing my face and then skin lotion, sometimes sun cream, and sometimes I'm outside to work toward the picnic. I have more protection the sun cream. So because the skin type is a little dry, yeah, sometimes oily. So I want to prevent my skin the function. Okay, very important. Okay, the summertime, so you have to more take the waters. So every day is 2 liters plus alcohol, maybe 2 gallon half is more easy to for the cell nutrition and then skin the moisturize. Okay. Today's question: why has reshaping the low face, the leg, and the jaw lines becomes a key area of focus over the consumer? Why everybody wanted more low face, leg, and the jawline? It's a top. Why? Because we change the hormone balance. Yeah, so teenager, and then 30s, the 40, the 60, 78 is more the same line. So teenagers have a hormone, a lot of the reproduction. So people they have acne or the skin allergy or not much, they change it. So but the menopause or estrogen hormone, the testosterone hormone, the change level times the 40 to 50 because of so many things change. Because they start the inner beauty and then they just we can see the skin type, they have the age spot, the tapping, and then we have the wrinkle. There's so many things. So they have more the production over some toxin because we have an inner beauty, little balance, and also hormone balance, and more outside layers. Yeah. So we have a lot of the solution. So we have to more basically some maintenance. Yeah, inner beauty. So hydration very important. Okay, and then also mineral, vitamin, the balance too. The page 19. This is the answer. The lower face, leg, and the jaw lines, the highly visible areas that naturally show sign of aging. Because top areas you can see more hair you can cover, but this is the low face and then jaw line you can see it's open. The people they know that, right? So they have she's young or he's old because they have to check this line here. And then some people have the shape round here, they looks like old. The shape is more young. And then also you have a leg. Here, so the line here is very important. They have a lymph circulation area. So sometimes lymph block, they more looks like the old and the more volume here. So everybody wants to shiny and then the slim, and they want the more younger. Looks like they have the maintenance here, the top here. The history critical to shoulder producer are the primary option for addressing their concern. Now, 2025, right? So most people they have the advancement, they really instead the technology. The plastic surgery. So plastic surgery, you have two types. They want to only the focus the beauty or the focus the treatment and then the surgical because we have something in skin the problem injury after damaged skin we had the more transfer this medical side. So this on the previous side you have the two options. So you have to apply. It's my skin is okay and then it's no injury, no damage. Only the A type is more just a beauty cosmetic surgery, but you have to mineralize, okay? Yeah, no cover. Because so many people have the suffer from the plastic surgery and the side effect, okay? Okay, questions. How have the GLP-1 medication influenced the demand for aesthetic treatment? I told you the GLP-1 is focused on medical weight loss, the medication. What are some of the NQ, the challenging is addressing aesthetic concerns, the following weight loss. Okay, so if you can try to the GLP-1 the product, the supplement, you can see the Amazon. You can easy the process. It's not without this doctor's application. Okay. What are some of the medical challenges in addressing aesthetic concerns following weight loss? Answer: GLP-1, the medication transform the weight loss landscape, but they often come with change in the skin elasticity and physical volume, and parents might not anticipate. Aesthetic treatments can address those concerns, and our consumers actually translate the positive to in this market. So GLP-1 before the beauty skin, the supplements products, the biotin, collagen, also the hair loss. People they want more hair growing the shampoo or the supplement, right? But now the plus the medication function, the GLP-1, and also more in fact, and they have more try to more innovation and the nano. Yeah, nano because in the collagen you have peptide, the collagen peptide 3, right? So usually normal peptide collagen, that absorption is the skin is very well. So peptide 3 is more peptide is more easy absorption, so they more the combine and collagen and also the C2, right? And then they have more collagen in the muscle, they work. So we have the more advantage over medication here and then the innovation together. Question: how do you address the gap between the wide range of skincare option and the consumer demand for scientific validity products? The answer to why is skincare markets offer awareness, the option, not all the products create equals. the concern is the becoming the more with the importance or effect the science back the solution. So this is simple answer. It's echo. Yeah, everybody wants echo. The problem now, because of 2024, 2005, and 2006, with the base of the chemical, 80%, right? Yeah, 80%. And echo naturally, 20%. But now they have more. The chemical ingredients more echo plus nutrition and the medication. Yeah, so before the little change, and but there's a high quality, high the volume, the fry. So now the products little change, more high technology and they have more good benefit, but the problem, the price, and then also before we have a more maybe 5 or 400 gram per milligram and 10 is liquid too here. They more the cut down to be 2 gram something. So they make it small and then more high quality, high price, but little down. So everybody wants this one, but now little the approach because we have the three the different. So but now is my option. I want to try this one. It's much better. Okay, because they have a more approach more naturally and then more the match the sweet skin the care herbs. Okay. At elegance, aesthetics, we purified rigorous the research to ensure our the skincare offering the support by clinical evidence, including 2000 the clinical impact studies, 90 peer reviews, publication, and 50 plus US the patient. So they have tried. So they have researched so many times, 5 years, they want to try the variety of age and then the sexual. So female or man or age because of the before, after the 50s, they more focus the hormone balance. And then they have the lifespan. So people try to more elderly and then more active person or office person. So they have a divide detail. So the 5 years tracking, they have the lifespan and then maintenance of the skin, the health. They try to have the evidence, the result, and also they apply to the research. Okay, the by combines high quality ingredients, the robust cutting edge science. So I already explained the high technology, the chain. So it's more good high quality. Okay, and then the before the lower ingredients and the plus alpha, right? So they have medication reaction and the more try to the innovative. By combining high quality ingredients with robust cutting edge science, we are empowering the consumer with a product that can trust deliver real results. The question: what roles do technology and regenerative medication play in the shaping the future of electric medicine? How about things? Give me the answer. How about your opinion? So I already explained the 2025, before 2024, 2006, right? So now the high technology industry in the skincare, the manufacturer, they have a lot of the research and try to apply the the trail, but before the all kind of scientific and then the researcher were the testing, they applied the mouse, right, lab, and then because of animal. But now they will change trend. They have tried to the seeking the more the human, right? So directly in the lizard, the real lizard. Because before animal, but now the human. The human the products. Okay, because they have a more detailed lizards and then apply your trail. Yeah, so they more the companies and the lizards is more approach people. The consumer they more trust. Okay. Answers: the technology and regenerative medication are at the forefront of our industry, the evolution. Advancement in AI and imaging technology will enable provider to deliver more precise and personalized treatment. So before we have over the products, the most people apply the same type. For example, the dry type, oily type, the combined type, right? So they made a product. This product for the skin care, skin type, more the dry and oily combined. But now the individual, the customized, the personalized skin care. So just the sell the products, they only apply the same, not too much different. But you have the skin clinics, the skincare shop, they individually they skincare and also blending medication. For medical aroma, right? Aroma, we have the product, so they the blending, just like the cocktail maker, right? So blending and then more the apply the personalized skin type is a more good techniques, is more high technology and the switch over the good care. Yeah, so if you have a chance, you can try to your skincare shop. Maybe one time, maybe a couple times you try the treatment. I think it's much better. Okay. Meanwhile, the different the medication is opening door to innovative solution that can help enhance the body's natural repair process. Yeah, it's very simple. Before we have the more regular lifespan here, but new technology, we have to talk with this open door. It's not easy, right? And it's not used to where it's trendy. So you have to keep your lifespan, and then you can try to research or you're reading the newspaper or TV or magazine. So you have to study and then you open step by, and the approach is much better. Okay. So for examples, by focusing on the stem cell, the biomaterials and growth factors, we aim to restore tissue function, and those regenerative cures, the enabling our body's stem cell to be birth limited the tissue. Now I have the stem cell, the mask, also the supplement, and we have the machine. Yeah, machine for the skincare machine. So the stem cell and the try, and then also oxygen therapy too. So it's not only one type of the medication or machine. It's not perfect. So we have to combine together the skill and then technical and then the product together, more synergy. Okay. So stem cell the supplement very good because they will boost the immune system and then the cell destroyed and then evolution and then rebuilt the more the cell neutralized and also cellulite removal, the toxin removal, the free radical, right? So free radical toxin the removal and the support to the energy, the cell nutrition. Okay. Yeah, so you can try to the stem cell. Okay. And also the stem cell injection, sometimes they make the treatments. So we have damaging your structure or the joint, the muscle, and the skin damage, they try to apply the skin cell and then injection the medication, they recover. Not the better ordinarily, but some more maintenance. Okay, so maybe the 70%, maybe they more recovery. This approach, the pivotal in both aesthetic and the therapeutic application, the showcasing our commitment in the innovation in the definitive medication. The stem cell and aggregating the collagen and then GLP-1, the same kind of the medication. The advancement, the polishing the boundary areas of what's possible in aesthetic medicine to offering the patient more effective, longer lasting and natural looking results. So anytime the product, the treatment, why you try that? Because you are more beautiful and then you are just younger and more healthy, right? So you can try apply it by yourself the before, whether you need advice by the cosmetic specialist and the dermatologist doctor. Okay, so they have given the guideline that you can follow. The question here, I want more question. Is there anything else you feel is more developed for clinicals or consultants? Yeah, this means when you want to choose your product or you are by the treatment by your doctor or your consulting field, so you have your peers, you have it because of some kind you shopping or you choose something, so you have peer, right? They're very important. So now the problem is so many people, young people, they have the more try to more approach the surgical, the plastic surgery, and more try to do more Botox filler. It's a normal, right? So trend, but you have to think about it, why I chose this one, because everybody wanted this one, so you have to follow, or you needed something the function and you needed recovery something. So you have to know that, right? So this made the discussion, right? Is there anything else your peers developed for clinicals or consultants? Because I announced we started 2 weeks ago. This is the course. We started the skincare, inner beauty, and then psychology and emotion together because everything combined. So that's why this question is a very good question. Answer: the clinicals need to recognize the growing importance to more patient education and trust in their aesthetic journey. So if a professional, the specialist, the employed skincare clinic owner had mentioned about the customer, why the choice, and then told your store, the clinic, and why. So you have to must study your customer desire, and then you're able to more the maintenance and or more approaching some more the political and the selfish, right? The self-political and then action. So you have to learning from the customer, so you have to give the good guideline and the customer to more happy, more activity, more PR, and then more outside activities, more the growing. Okay. Education to become the more informed. They are looking to their providers for guidelines on everything from the treatment option to post care, the skin care. The staying informed about emerging trend and the science the behind the availables. The treatment key to posting the truth and delivering the best outcomes. Additionally, it's a holistic approach that combines aesthetic treatments, wellness, and skincare help patients achieve their goal more complexity. Yeah, this means my answer is same, right? So after the post-surgery or treatment, how come the customer desire more approaching and then more the goal, right? So maybe for example, I give the for example the wedding ceremony, right? So wedding ceremony, so many people had the big ceremony, right? And the man and the girl, the set, right? So they combine into one. So they have but it's a very beautiful day. So everybody want more makeup and then they make it charming and then they will try to everything, right? Couple days of hair repair and then more cosmetic care. So why? Because very important, right? So we just studying today. So one by one, but now it's two, right? Two and then one. So sometimes we have the big ceremony or something very important today, the interview, the job interview, or you can meet dating, or you have the meeting, the partner or the business partner, right? Meeting. So you have to do more stack. So you shaping and then you have the more eyeliner and the more lip balm and the more the skin lotion and then from. So because we had more everybody, we have something event, so decide together the makeup and the treatment together. So they have more pills, more so comfortable and more desirable, more positively, right? So because I want more approach the people, they're more clean and beauty and more charming and the good manner and they try. So we had to together the beauty, the maintenance by settle lifespan. Okay, so this products and education or the maintenance or medical surgery and everything is overall is maintained by the evidence of scientific and degenerative medication and the medicine, the cosmetic product work together. Okay. Additionally, is holistic approach that combines aesthetic treatment with wellness and skincare help patients achieve their goal more comprehensively, right? So we had to approach more holistic care because before we don't know neurology and not study, so we need the shopping, the hand and the trend, right? The hot sale, or you can see the little exposure your media, the advertising, the cosmetic, the product, the company, right? Company advertising API. So we hand in hand, but now we have to more the suite apply your customer individually customized and the customized skincare. So little change it into trend. Okay. 22. The body contains the facilities decretion among top researchers, the physician and other innovators. We can explore cutting-edge science that evolved the correct approach to aging. The shifting in the industry dialogues from the lifespan to health span. The building trust towards culture, the competence, and the aesthetic democracy. The key takeaway: the passion of color taste vary in the aesthetic democracy, including in fact be at the indicated clinical training differentiation. In practice, treatment outcome is a trust. Yeah, because we didn't trust the cultural competence or aesthetic democracy, right? So any kind of education had evidence by the scientific. So the skincare is very important because only the skincare, no. We had to base on the demography, okay? asthmatic demography, we had the theory, we had to study is more shape and more synergy, the maintenance. Okay, so that's why this is the guideline the announce you. Historical district in the medical system among black and brown communities need to delay care and save health outcome. The cultural competence involved understanding diverse skin presentation, acknowledging cultural beauties, norms, and inclusive communication. The providers should diversity difference imaging, ask open-ended question, and educate staff for improved care for patients of color. Long time ago, I used to work the beauty supply and then the hair products and the black the people with them. Yeah, because people the hair and then wear hairs very different. So they have to spend time more the bleaching and the hair, and because we have here the hair, they have really this one and the black this one. Yeah. So they had to every day, every couple of days, they had more the wax, and also they had more mending, because it's not they come in here, the hair, they come in the skin, they have the infection, so they have some problem. So we are usually 1 month, every month I cut hair. So but they had every day they had the wax and packing, also they have the medication too. So this cultural depend. Also they have India where they have more haircut, right? There are some people they have the haircut the error here, right? So the cultural, and then also this cosmetic industry, and then also cultural, and then functional, and then duration, they depend. Okay, so you have to consider about this one. Okay. The provider should liberty difference image, right? And then also the improve care for the patient of color and then cultural and then aging too, and also health condition. Okay. Yeah, for example, the cancer patient, right? Everybody they haircut, the chemotherapy, right? So we have to think about it, okay? So this cultural duration doesn't matter. It's because cancer patient, the hospitalized, and the people, the different story, right? So we have to do more the study, the care, the more to care the patient. 23. The period over aesthetic demography has witnessed its functional the growth over the past decade. Adaptation of color continues to face the scientific the barriers to care ranging from the inflect, the base to inaccurate representation in clinical training. Those challenges have a direct impact on treatment outcomes, the patient certification, and the trust. The cultural component is more than the visual, it is a clinical impact. The trust gap, the 23 page, right? The historically is the black and brown communicate have a previous relationship in the medical system. The black and the brown community, including demography, the misdiagnosis, inaccurate treatment plans, and poor communication continue to drive district. Yeah. So black, the brown, the white, the brown, it didn't matter. So we had the medical system, and also the patient of condition, health condition, and the cultural the condition, degraded the condition, we have to consider first, okay? Because of maybe misunderstand your customer lifespan and then cultural, and regular, and the personal care, they will misunderstand that they don't have no trust. Okay, so community and communication very important. When it comes to asthmatic cares, that distress upon manifest but surgical the beauty, the standard that the realist the outcome the relentless skin. In my own practice, I frankly counters the patient who were listening to speaker asthmatic treatment due to prior negative experience. Yeah, so everybody have the negative experience or positive experience. So negative experience, they don't want to try to do any product and any the treatment, right? The side effect or the scare. So if we have a good memory of the good experience, positive experience, anybody no advice or nothing. So I choose myself, right? They're different. So it's a good the impression and the positive experience very good for the PR and the marketing, and also they more digital mouth. The customer they come in a lot, so it's very important. So you have to try to the personal care, and then you educate your the employer, and you approach the more sweet the individual the personal care is very important. Okay. The page the 24. The some share story our being store their skin was too difficult. It's not easy because only the skin type and what kind of the skin cancer, what kind of the skin damage, and hormone balance reaction or allergy, right? Because the infection, it's not easy. It's very difficult. So any kind of medication doesn't work. It's a terrible. It's a emotional problem, and then you have a depression. Yeah, because of so many things they combine. So especially the pace very important, right? So you had a too difficult, but you had a more easy approach to the skincare product by evidence or scientific, and when the generative with the product, personal care is very important. Other expressed concern that providers not trained to treat their skin type or cultural features in the appropriate way. How are you? Some patients have even disclosed that the provider treats their skin knowing they lack the training or understanding the listening to safety result. So this means everything is good, high quality, good price, and safety ingredient, but it's not sweet for the customer, nothing, right? So we have to apply more good care, means the products, the customer, and the condition equal is good match. Because sometimes the cheap the skin product is good for me, but sometimes good brand or high quality cosmetic is not good for me, right? It's so very simple. So this means we have to equal. It's a balance. Okay. In that case, the product offers to prioritize over patient the safety. In my opinions, this is a dangerous attitude any providers to treat patient without the humility to admit when on select the appropriate is praised. This agrees the foundational the principle of medication to the no harm. So everything have principle and then knowledge and then evidence. Evidence means the scientific with approval. FDA or have the more lab testing, GMP, we have a lot of mark in the product, the sign, so organic, so no GMO. So we have to more looking at the more very be carefully. We have to check So what kind of ingredients? Because maybe you allergy honey or chamomile allergy or catechins, so green tea is good for everybody, but some people have the allergy. So you have to check ingredient first. Okay, it's very important. No matter how long you have been the practice or how experienced you are, we must remain open to learning. So yeah, this is very important. I'm the leaders. I read books. One is 300 over. So I never think I know everything. I never think about it. And all the time I did something, want a new learning knowledge, because now too many the technology, knowledge, and then trend, education. They have everything. They change it. Also AI. Yeah, AI is very high technology, right? So I used before. I never using the AI, but now recently I launched the ChatGPT, the AI. So they're very smart. So I had to do more using the technology. I had to more know that. I had to more study, and then I give the homework. I give the question. They give the good answer. But I don't have no knowledge and no experience and nothing. I give a simple question. The ChatGPT they give a simple answer. So that's why. So everything's good, but some maybe at least one piece of something mistake, something ingredient good for me is dangerous taking my life, and then allergy too. So we have to know that. We have to study myself, the skin tone and the skin health and innovating the condition, and we have to more second choice the product. It's a smart. Okay, so when I study myself, only the person or the products is not good for me. Okay. The growing education and crucial is not optional. They have an essential to delivering ethical and then effective care. The for many Africans, Americans, the peer or citizen about the seeking demographic or even general care is a different route. So usually probably people they don't know the study evidence the knowledge route. So I told you right, the black and the brown, the white brown or it matters. So because they have a little change, high technology and change more developing the product or research, but they have the same root. So root is the echo. Yeah, because this means we have a tree, right? We have a tree here, yeah, tree here. You know, root, the small light here, but it's a root, the same. The same here, but some change high quality they cut and then the other tree and the can here have a different fruit, right? But you have the root the same. That's why you have the democracy and the skin or what kind of technology have a root. We have but we have the evidence too. No evidence, no root. Maybe we don't know the identity of proof. Okay? Yeah, because here's the main, right? But we have the other tree they give it here, the combine here, different fruit, and A and the B. Maybe the other fruit here, maybe C. So maybe we have a click behind the piece, they change the DNA, right? Yeah. So this we have to know that it's a root. Okay. Yeah, 25 page. The some believe skin the treatments is not for us. It's only for white patient. This means I have a product. It's good for me. It's not you. And then it's not you. But this product we apply me and then you together. Different? Only you, it's not me. So each product, we have to apply the individually. And then also personally, the care approach is very important, right? So when they do finalists seek help and mistreat the importers, they are decreasing the returns not just for skin care, but for others' health needs as well, including gynecology, prostate care, and pregnancy health screening. This daily often results in latest diagnosis, more severe outcomes, and even avoidable deaths. The what beings or bad experience in one areas for care can lead to disparate effect occurs or health access. We must do better for African Americans, Asian, and all patients with active skin tone who deserve include the informed and the comprehensive care. Yeah, very important. Why I have one episode. My business tailor have a little spore in the skin cancer. It's not dangerous. Just like AIDS part something, but very simple. Democratic doctors say then just 2-hour surgery after lasers, very easy treatment. You can back home. But problem after 6 hours, she pass away, die. Because nothing. It's not easy. But she don't want refuse. But husband want to try. And after this one, try after you do some of the trip. But 6 hours die. Why? Because the skin is very small. But the medication they come inside here, I think maybe she have problem the health condition, right? So this means very simple the skin care problem, nothing. But you give it a surgery or some medication, maybe that. Yeah, some people have the jawline they don't want to cut. They very dangerous here. So many low and then very danger. But after surgery, maybe have a bad experience. They have the die, like the pass away. So you have to keep just irregular the skin problem. Just cover a different way. The mask or BB cream or collagen something, and then you repair temporarily, and then you supplant your casually your home care is much better. Okay, so we have to think about this. Sometimes it's very dangerous the medical treatment. The cultural competency as clinicals, the competence for democracy and providers. Developing cultural competence means understanding, number one, understanding the device presentation of skin condition in mandates rich skin. Melanin, melanin is very important because we have age spot or wrinkles, they have a melanin the problem. So second, acknowledging the cultural beauties, norms, and how they shape the patient role. And the speaking either impact, avoiding dismissive or irritative language. So public people they don't know the detail the democracy word. So medical word they don't know. So you have to easy democratic doctor or the specialist they have to easy explain. So customer very perfect understand. So we have to more sign to and give the service much better. We have the no blame and each other and the more good care. Okay. Sometimes democracy should not explain the customer misunderstood, and after surgery, some of the good experience okay, but sometimes bad experience or some the side effect can have no further the problem too. This also involves self-awareness, describing what you don't know, where beings open the lens. The providers must actively seek out continuing education, case study, and then mentorship, then include patient of color. So you have to study because you not this major, but you have to know that you self-care and also you can care your family, right? So you're not learning only the one part, the only information, just the regulating routine, right? Maybe sometimes you have some problem, you don't have a solution. You have to pay some big money, right? So you're learning, you try to take the newspaper or magazine or media, so you can see you little more to study. Okay, so because protect your the self skincare. The case benefits a woman in her early 40s case, a woman in the early 40s visit my clinic after poor experience in a major treatment at another facility. She had physical vision and had been treated without proper setting or guideline. Not only this, she experienced post-inflammatory hyperpigmentation, but she also left feeling emotionally dismissed. Yes, Walker, right? So this customer case is very comfortable because only is my clinic not coming. She tried to do the clinic. So this clinic and other clinics, the physician or democrats, the skincare professional, they technically changing and then it's not same, right? They using the same liquid or medication or working the skill, they don't know. So maybe to combine the issue, so more this clinic owner maybe take risk because of dangerous, because maybe mistake maybe damages skin. Yeah, so the customer maybe it's not sad and it's not happy, right? Yeah, so this case we had the skincare, we tried the one keep going, the cleaning is much better. No shopping. The medical shopping means this doctor maybe good is a try, it's not, maybe try here. Maybe the other one they have see all the damage, the skin or whatever. This has the issue, right? So you have to give it, maybe you trust one doctor, you try keep going, it's much better. Okay? Yeah, so usually I understand because I have the rules that sometimes I treatment to my patient and the patient try to get her the clinic and then she come back. I know that she tried the other clinic because I check the muscle or the joint here is different. So you have the skin is very good, yeah, good position here. So you have to be careful, okay? She had the physical physician, the treatment, so they have some problem. During our consultation, I listened without judgments, validate her concerns, and explain why certain lasers can cause harm to the skin. We developed step-by-step plan to safely restore her skin tone while also rebuilding our confidence. So this the specialist talk announced. We have a consultation. We have the new patient coming. It's my clinic. We need a consultation, right? So maybe very important. Maybe without the customer thought or experience the clinic, without listening, we have easy misaction or mistreatment. So we have to listen to the carefully the customer, the choice, the other, the experience, better or not, and what kind of medication, and then what do you have your medication and how about your health condition. So we have to know that. Okay, some more step the treatment. Okay. 27. The practical stages for providers. Diversity your reference images. Ensure that before and after the photos reflect the spectrum of skin tones. Yeah, this one I using the AI, the skin analyze. We can take picture, we can turn skin tone, and then we have a color and dry or hydration, dehydration, cell nutrition balance. We know everything. So this theory and the evidence about the scientific AI analysis. Okay. Ask often in these questions, what does beauty mean to you? This means why you want surgery, why you want skincare. This means can reverse delays, decrease personal preference. Second, avoid assumption. Do not assume every patient want light skin, the smaller picture or westernized results. So you have to listen to the customer orders. Without the customer like orders, oh maybe she want more the white color, white tone. Maybe she want more too small. She want to, don't think about your by self. So you have the best buy or the customer the order. Okay, so you have the good results and then the customer certification. Okay. Educate step, the front desk and support staff should be trained on increase with the communication. So at least you have to educate the staff. So the customer service skill and then we have the concentration during we have the detail. So we have to know what kind of disease, what kind of medication, where, how they experience good memory or good experience or positive or negative, and then result, and then what kind of more additional service. We have to know that perfectly 100% the based by the customer orders, and then we advise it's a good result. Okay, so maybe it's not detailed, and then you not listen to the customer order, and then you have a big mistake. Okay, the communication very important. The consideration, the cultural competence not optional. It's foundational to shape and then educate cares. As aesthetic medicine involves so much our ability to meet the patient where they are. The honor their lives experience and create a space where they appear scenes to hear the values. The population of colors, the breeding trust may take more time, but it's the key to lasting therapeutic relationship and the optional outcome. Yeah, so today we studies 2024, 2025, 2026 trend. So before we have the chemical ingredients we usually focus here, right? So because the manufacturer want money and it's money because of trend. But now 2025 leaders, high leaders in the story about the cosmetic manufacturer, they want to try the research and they more approach eco and naturally. But 2026, maybe 10 years the base, they come more plus alcohol, they have the skin ingredients, products, chemical is a little down and try to echo and then additional medication condition. So high technology in the story, but now we start so maybe price very high. But I think it will be after 2 years, 3 years, maybe the public it may be good price and everybody want to try this one. Okay, so this manufacturer, they have a more cut down here. The high technology and then echo too. So the customer had to go recognize this trend, and also the provider too, with the learnings, you have to more education, the trend, and then more try to study care for the service, the customer, the health issue, and then skin problem and the inner problem. So you have to know that it's a more good result, okay? Yeah, the optimal outcomes. The 28 page, what is alternative medicine and how can you benefit from it? So, just skin care and alternative medicine and the functional alternative medicine, what's that? So why is it be difficult? Why? Why we have to take out this choice? What kind of benefit this one? Okay, I explain to you. Alternative medicine is a broad term applied to any specific that involve the process of modifying the patient's physical appearance, whether it's to improve person's taste and body or to reduce the risk of certain type of disease, including obesity. The medical aesthetic include to medical treatments that focus on improving the aesthetic appearance of a patient. Qualified doctors, nurses, and the dentist can provide you the multiple imaging adjustment to improve your appearance. Yeah, so dentist, nurse, doctor, they use injection. This mention about filler, the botox they can do. Yeah, because the dentist, they have the product here, medication here, the dental treatment, right? And so, yeah, to qualify the doctor, nurse, the dentist, they had to do. But regular the skincare specialists, they can do. Okay, the many cosmetic push-up, the first, military incentive, shape, effective, and require little downtime. Medical expectation focused on advanced treatment, beautifying repairing the skin. Their treatments may include microdermabrasion, the chemical field, the skin rejuvenation, and variety of laser treatments are aimed for depleting the skin and removing unwanted the pigmentation or fine red or purple lines or the spider beam that results from you can't more damage the graft tissue. So as in medicine, so we had to cover all the medicine and the type, the skin and the inner, the pincus, the spider beam, and the obesity, the wrinkle, the cellulite. So all together, they're handling this medicine, aspecting medicine, medical here. 29. The medical expectation can also assist your patient in the application of injectable cosmetic treatment. The suture dermal fillers and more treatment options being developed all the time. The field of medical aesthetics, the professional and the certified practice and medical aesthetician required insightful training in the safety and effectively administering the virus or treatment in the field. So professional aesthetic, they had to know that everything, the rollage or the skin dermalizing, so the skin, the inability, the detox, and the skin, the weight, the cellulite, we had to know everything learning too. They know the anatomy of the skin in the application of our chemical and the laser treatment, and the constantly studying new products and imaging the products to keep informed about the latest technique and then technology. So this means skincare specialists, they don't know every product name or ingredient. You can sell in the customer and then can advise your customer the type, right? So we have to know it. And learning and then have to give the service provider the service good information. Especially our aesthetic medicine not limit dermatology and plastic surgeon and doctor or all specialists the seek to offer service to address the aesthetic need and then desire or their patient. So patient respects the specialist. The specialist have to everything know that. Yeah, so she had to try the manner, try the product, and then treatment, and then care the customer emotion, the cellulite, obesity or diet. So the specialists have the very rich for the knowledge, the customer respect them, and then have the trust, and then the good positive experience. Okay. So it is also very important that medical exchange to be incredible providing teams approach the minimalist irreversible facial aesthetic products. Aesthetic medicine represents completely new moderns and cutting-edge field of medical practice. Any medication or medical producer specialized or intends to improve our cosmetic appearance is encompassed by term medical aesthetic. So medical aesthetic medicine and include the functional and the natural body, the skincare, healthcare, everything involved. Okay. The based on all of the practice, it is the estimate that the medical aesthetic industry will experience repeats grown over more than 12% by 2025. So although there is obesity conditions, aesthetic doctors should not be confused dermatology and plastic surgeons. Although many dermatologists and surgeons can also practice aesthetic medicine. So not that doctor and the nurse and the dentist can try injection, okay, but the surgery only the doctor, right? Nurse and then dentist do not cover the surgery. Okay, but they have to know that keep the neurology and dermatology and then healthcare and the medical aesthetic neurology have to know that. Okay. This is what the separate aesthetic medical treatments from the beauty treatments such as eyebrow threading, the waxing or eyelash extension. So this one very loud exposure the neurology, the treatment skill. Aesthetic medicine encompasses or medical producer then maintain the improve physical appearance that patient satisfaction. Using non-invasive, minimally invasive cosmetic products. A well-trained medical education is up-to-date knowledge or knowledge technically is your best for the success in the aesthetic treatment. Why? Because the human time is the peak, right? It's not changing. But I told you, right? The weather and the hormone balance and sometimes in casualties happen infection or some the allergy, food allergy and accident. So it can anytime just changeable. So we had the learning from the customer, the condition. Also, it's a normal customer or the specific customer, this customer or white, brown color, black, you have the color. So and then also I told the black and the people have the hair types. They is not maintenance every day, so they will have the infection. So we know everything. So we had to learning from the customer, and then also we had to more study the dermatology, and then we had the biologism, and then skincare products, and then we have the technical, it's a high technology and also technical too. So they will everything have and the good the treatment the skin. Look for the safe the holistic care the customer health. Always train the medical education is up to date knowledge that's taken in your best effort to success in the aesthetic treatment. Okay. You may be wondering what exactly medical aspect would impair. The golden scale center has put together the following information to take a little mystery out of our purse and have it more answerable. One, by the answer, we see that the medical aspect means how you can benefit from it. Aesthetic medicine is a broad term to apply to any specialty that involves the process of modifying a patient's physical appearance. Whether it's to improve person, health and body, or reduce the discover certain type of disease, including obesity. So, not only obesity, also they have the inability and the weight loss, the obesity. So that's why GLP-1, insulin, the factors, the ingredients that try to the skin care, they try it's optimal the maintenance of health. Okay. Okay, today